Another day, another story. Treatment of UTIs. Urinary tract infections, UTIs, are typically treated with antibiotics to kill the bacteria causing the infection. The specific antibiotic and duration of treatment will depend on the severity and location of the infection, as well as other factors such as the patient's age and medical history. Some commonly used antibiotics for UTIs include ciprofloxacin, Cipro, and levofloxacin, Levaquin. In addition to antibiotics, healthcare providers may also recommend over-the-counter pain relievers such as ibuprofen or acetaminophen to help alleviate discomfort from UTI symptoms. It is also important to drink plenty of water and other fluids to help flush bacteria out of the urinary tract. If the UTI is recurrent or caused by an underlying medical condition, further evaluation and treatment may be needed to address the underlying cause and prevent future infections. It is important to complete the entire course of antibiotics as prescribed, even if symptoms improve before the medication is finished. Failure to complete the full course of antibiotics can lead to antibiotic resistance and make future infections more difficult to treat. Antibiotics for UTIs. Urinary tract infections, UTIs, are often caused by bacteria and are typically treated with antibiotics. The choice of antibiotic will depend on the type of bacteria causing the infection, as well as factors such as the patient's age, overall health, and any allergies or sensitivities they may have to certain medications. Commonly prescribed antibiotics for UTIs include trimethoprim, sulfamethoxazole, TMP, SMX. This is a combination antibiotic that is often used as a first-line treatment for UTIs. It works by blocking the production of folic acid in the bacteria, which they need to grow and multiply. 2. Nitrofurantoin. This is another commonly used antibiotic for UTIs. It works by damaging the bacteria's DNA, preventing them from reproducing. 3. Ciprofloxacin. This is a fluoroquinolone antibiotic that is used when other treatments are not effective, or when the infection is caused by a resistant bacteria. 4. Amoxicillin clavulinate. This is a combination antibiotic that is effective against a wide range of bacteria, including those that cause UTIs. It's important to take the full course of antibiotics prescribed by your healthcare provider, even if you start feeling better before the medication is finished. This will help to ensure that all of the bacteria causing the infection are killed and reduce the risk of the infection returning. Natural remedies for UTIs. While antibiotics are the most effective treatment for urinary tract infections, UTIs, there are some natural remedies that may help to relieve symptoms or prevent UTIs from occurring. Here are some examples of natural remedies. 1. Drinking plenty of water. Drinking plenty of fluids can help to flush bacteria out of the urinary tract, reducing the risk of infection. 2. Cranberry juice or supplements. Cranberry juice or supplements may help to prevent bacteria from adhering to the bladder and urinary tract. Probiotics. Probiotics, such as lactobacillus, may help to promote healthy bacteria in the gut and urinary tract, which can help to prevent UTIs. 4. D-mannose. D-mannose is a type of sugar that may help to prevent bacteria from adhering to the urinary tract. It can be taken in supplement form. 5. Uva ursi. Uva ursi is an herb that has been used for centuries to treat urinary tract infections. It is thought to have antibacterial properties that can help to eliminate bacteria from the urinary tract. 6. Avoiding irritants. Some substances, such as caffeine, alcohol, and spicy foods, can irritate the urinary tract and make it more susceptible to infection. Avoiding these substances may help to prevent UTIs. It is important to note that while these natural remedies may be helpful in preventing or relieving symptoms of UTIs, they are not a substitute for medical treatment. If an infection is present. Cranberry juice for UTIs. Cranberry juice has long been thought to be an effective natural remedy for preventing and treating urinary tract infections, UTIs. The idea behind this is that the active compounds in cranberries, called proanthocyanidins, can prevent bacteria from attaching to the bladder and urinary tract, which can help to reduce the risk of infection. However, it is important to note that drinking cranberry juice alone may not be enough to treat an existing UTI, and antibiotic treatment may be necessary. If you are interested in using cranberry juice as a preventative measure for UTIs, it is important to choose a pure cranberry juice with no added sugars, as added sugars can contribute to the growth of bacteria. It is also important to drink enough fluids in general to help flush bacteria out of the urinary tract. Prevention of UTIs. There are several steps that can be taken to help prevent urinary tract infections, UTIs. Some strategies for prevention include: practice good hygiene. Wipe from front to back after using the bathroom to prevent bacteria from spreading from the anus to the urethra. Avoid using strong soaps or hygiene products that can irritate the genital area. Stay hydrated. Drink plenty of fluids, especially water, to help flush bacteria out of the urinary tract. Urinate frequently. Don't hold urine for long periods of time, as this can allow bacteria to multiply in the bladder. Empty the bladder completely. After urinating, try to empty the bladder completely to avoid residual urine that can lead to infection. Avoid irritating substances. Avoid using irritating feminine products such as douches, powders or sprays. Use condoms during sexual activity. Using condoms can help prevent the spread of bacteria that can cause UTIs. Take showers instead of baths. Baths can expose the urinary tract to bacteria, increasing the risk of infection. Take cranberry supplements. Cranberry supplements may help prevent UTIs by preventing bacteria from adhering to the walls of the urinary tract. Avoid spermicidal agents. Spermicidal agents can increase the risk of UTIs. Kindly subscribe and like my channels. Thanks for watching.